Hello, welcome to Health Chat. I'm Dr. Alancia Wynn. Today we're going to be talking about eye diseases that predominantly affect the elderly. Now before we talk about the things that can go wrong with the eye, let's talk about the parts of the eye so you know what we're talking about. Meet our friend the eyeball. So this is the entire eye. So this is what sits behind in your socket in your eye that you can see. So let's start from the front and go back. So this part here is what's called the cornea. So this is, if you wear contact lenses, this is what your contacts sit on. So let's take the top off here so we can see the other parts. So in between these two sections, there's some fluid that would sit right in there, and that's called the aqueous fluid. So if we take the cornea off, the next thing we come to is the iris and the pupil. The pupil is the little, if you look at your eyes, that little black spot in the center, that's the pupil. That's that right there. And what that is, that's the hole where the light actually comes in from things that you're seeing. That's how it gets into your eye. This part here is called the iris. So not only is it what makes your eyes nice and pretty and colorful, it also has little muscles in it that cause the pupil to get smaller and get bigger depending on the light. When you're in really bright light, it causes it to constrict down so that you don't damage the inside of your eye because of the bright light. But when you're in a dark environment or dim light, it enlarges to maximize the amount of light that comes in, to maximize the amount that you can see. The next thing behind that is what's called the lens. That's what this part here is. So just like the lens in a camera, this is what causes the vision, what causes the light that comes in and your vision to focus. So the light comes into the pupil and then it goes through the lens and then it focuses onto the retina in the back, which we'll get to in a minute. So once you get past the lens, then you get into the interior of the eye. So all of this red part here in the back of your eye is what's called the retina. That's where all of the nerve cells are. So everything that you see is because of what's going on in the retina. Now, all this space that you see here that's empty in your eye is not empty. It's filled with this kind of gelatinous substance which is called the vitreous humor. And what that does is that what keeps your eye nice and round. It keeps your eye from falling in on itself. So you can kind of think of it as if your eye is a water balloon, this will be the water that keeps it open. So all these blood cells are you can see all the little blood vessels in there as well that keeps the retina nice and nourished, keeps it alive. So all those nerve cells that are all across the retina, they all come together into what's called the optic nerve, and that's what this here is. And that goes from your eye up to, you can go, it goes out of the back, goes up to your brain, and so all that information that gets gathered in the retina gets collected here and goes up to your brain, and that's how you see. So now that you know all the parts, or one part I forgot to mention that you can't really see in this model, it's not really designated on here, but somewhere about in here would be what's called the macula. And what the macula is where all those things come together. When they come from the lens, all that light, it focuses in the macula. So if I put the lens back in, you can see the light will come through here and it would all focus somewhere about here. You can see it there. That would be the focal point. That's called the macula. All right, so we know all the parts. Don't worry, we'll go over it again. You don't have to remember everything now. There will not be a test at the end. I just want you to hear the terms to get it's kind of a visual as far as where things are. And I'll be going back to this as we talk about the different things that can go wrong. So the first thing we're going to talk about are cataracts. What are cataracts? Cataracts are when the lens itself gets cloudy. Remember, that's this part here, the part that causes you to focus. So like the lens of a camera, takes all that light, focuses it in. So and it's made up of protein. So when all the proteins that make up this lens, when they get cloudy, it's harder to see through. So you can think of it like if your windows get dirty or if your headlights on your car get dirty, that's harder to see. Same thing happens with the cataracts with the lens. What causes those proteins to clump up? Well, we don't really know. But it can be in one eye or both eyes, and you can start off with having one in one eye and then later develop one in the other eye. This is not an infection, so it doesn't spread from one eye to the other. So if you get it in the second eye, it's just that you're developing it in the second eye. And if you do have it in both eyes, they will grow at different rates. So if one may get worse, so even if you start off with both of them at the same time, one might get worse faster than the other. Now, once you develop cataracts, it can take several months or even years for them to grow to the point where they really start to affect your vision. But sometimes they don't even get that point. So sometimes you can have a cataract that's small and it may not even get to the point where it affects your vision over years. Your eye doctor may just keep saying, yeah, it's there, but it's not changing, it's not developing, it's not causing any problems. So what causes cataracts? As I say, we don't really know what causes it, but there are some risk factors that can increase your risk for developing cataracts. Number one, just normal aging. People develop cataracts as they get older. People who are diabetic are more prone to developing them. People who have been out exposed to bright sunlight, especially people who don't wear sunglasses out in sunlight, are definitely more prone to developing cataracts as they get older. Anybody who has a chronic eye disease, anybody who's been exposed to any type of radiation that can affect the eyes, if you have a family history of cataracts, that increases your risk. If you smoke, that increases your risk. People who have used any steroid drugs, especially people who have had to put steroid eye drops in their eyes, that increases your risk. If you have had any surgery on your eyes or any injury to your eye, that increases your risk. And interestingly enough, it can be years or even decades after the surgery that your cataracts can develop. So how do you prevent the cataracts? Well, since we don't really know what causes it, we can't really say for sure what you can do to prevent it. But number one, you want to wear sunglasses anytime you're out in the sun, and you don't want to smoke. And if you do smoke, you want to quit smoking, because even if you have been smoking for a long time and you have already started to develop cataracts, if you stop smoking, that will slow the progression of it even more than it would have progressed before. So what are the symptoms of cataracts? Usually the first thing people notice is some blurring in their vision, and it's usually you first notice it when you're driving at night. So if you are driving at night and the lights can sometimes they scatter, where you have those little rays of light coming off of the headlights, or you may see halos around lights. That's usually an early sign of a cataract. People can start to develop difficulty reading. The colors, when you're looking at things, the colors are not as sharp as they had been. They start to fade a little bit. You start having more trouble seeing at night. Some people start developing double or even triple vision. And some people notice that they start to have to change their vision prescription more frequently than they had been, either for their glasses or the contacts. So if you develop cataracts and they progress to the point where you need treatment, the treatment for cataracts is surgery. And what they do for the surgery is they take the cloudy lens out and they replace it with another lens. But again, not everybody who develops cataracts needs to have the surgery, but it is a pretty common surgery. It's a pretty, I won't say a benign surgery. I won't say it's an easy surgery, but since it's a very common surgery, the vast majority of people who have the surgery, their vision vastly improves when they do have it. So the next thing we're going to talk about is glaucoma, so that we're moving a little further back in the eye. So what is glaucoma? Glaucoma is an increase in the pressure in the eye. First, we need to talk about what the pressure in your eye is. It's called intraocular pressure, which just means pressure inside the eye. So how that pressure in your eye is maintained, because we talked about that you have fluid. Let me put the lens back in here. You have fluid between, put the cornea back in there so you can see. There's fluid between the cornea and the lens, so there's fluid in that little crack there, and then there's fluid in this big space here. So this is called the aqueous fluid, and this is called the vitreous fluid. And the fluid flows from here to there and then out of the eye. And you can't really see it on this model, but somewhere down in there are little spaces where the fluid will drain out of the eye. And normally that's imbalanced, so the fluid just flows normally. But if for some reason you have a problem with those little drains down in there, then that means the fluid doesn't flow out properly, so the pressure starts to build up because you start getting more and more fluid that's not draining. And so we don't really know what causes those drains to be clogged or to get clogged. And you have two different types of glaucoma. You can have what's called open angle glaucoma, or you can have closed angle glaucoma. Makes sense, open, closed. So if you have that the drains become clogged, that's what's called open angle glaucoma. That's the vast majority of people who develop glaucoma. If that angle is smaller than it should be, either because you have scarring around the drain or it's just been, you have inflammation around it, or any number of things that can cause that angle to become smaller, that's called closed angle glaucoma. And so the treatment for the two are slightly different, which we'll get into in a little bit. The number one reason we worry about glaucoma and worry about the pressure in your eye is because of this little thing right here, that optic nerve. So as you can see, this is a big salad bowl, essentially. So if the pressure in here gets bigger, that pressure has to go somewhere, so it just pushes out. So it pushes out against the retina, which is this part back here, and it pushes against the optic nerve. And when it pushes against the optic nerve, you can't push on a nerve for an extended period of time without it causing damage to that nerve. If that nerve gets damaged, then you have vision loss. And so that's the thing that glaucoma causes, which is why we worry about glaucoma, which is why we treat glaucoma. So who gets glaucoma? The risk factor, number one, is age. So primarily it develops in people who are over age 45. People who have been diagnosed previously as what's called a glaucoma suspect. And what that means is you have had the pressure in your eye has been elevated in the past. So you've gone to your eye doctor, they said, hey, your eye pressure is high, but you don't have any damage to the nerve. Everything looks okay. We're just going to keep an eye on your pressure. The longer that pressure stays up, you can start to develop glaucoma. And what glaucoma is, the definition of glaucoma itself is once you start having damage to the nerve from that pressure. So if you've had elevated eye pressure for a long time, even though you haven't had any damage, the longer that pressure is up, the more you can get, the more likely you are that you will eventually get that damage leading to glaucoma. People who have a family history of glaucoma are at higher risk, as are people who are diabetic. People who are nearsighted, especially people who are really nearsighted. So the higher the number on your glasses, your prescription, the higher that number is, if you're nearsighted, the more likely it is that you will develop glaucoma as you get older. People who have had injuries to their eyes in the past, people who have been on steroids for long term, again, steroids in pill form or steroid eye drops especially. There's also a genetic component to this disease as well. There is a high risk among African Americans for reasons we don't really understand. And interestingly enough, people who have low blood pressure, if their blood pressure in their body is low, especially if it's low for a really long time, that increases your risk for glaucoma, again, for reasons we don't understand. So how can you prevent glaucoma? The main thing you want to do is not necessarily prevent it, because there's really no way to prevent it. But one thing you want to do is you want to catch it early. So you want to have regular eye exams. If you wear glasses or contacts, you definitely want to get your eyes checked regularly for any number of reasons. Most times if you wear glasses or contacts, you're getting your eyes checked once a year. Even if you don't wear any type of corrective lenses, you still want to get a regular eye exam. Now, if you are someone who has any of those risk factors we talked about, family history, your eye pressure has been high in the past, you are a diabetic, you want to check, or if you're over the age of 45, you want to get your eyes checked at least every 2 years. If they're watching anything, you may need to get it checked more often, but minimum of every 2 years. If you don't have any risk factors, you want to get your eyes checked once every 4 years, and that should be enough to catch anything that's developing. So how do you diagnose glaucoma? Well, you have to have an eye exam that will measure the eye pressure. You can't look at someone's eyes and tell if they have glaucoma or elevated eye pressure. So your regular family doctor can't determine if you have glaucoma or elevated eye pressure. You have to go to an ophthalmologist or an optometrist to have them measure your eye pressure. Now, there are a couple different ways that eye doctors can measure your eye pressure. One, which you may have had done, is you put your face in the little machine and they have the puff of air that blows in your eye. And what that does is it measures the resistance to that pressure as it comes back. And so that tells the machine if your eye pressure is high or not. If you go to an ophthalmologist, a lot of times they'll use kind of a blue light and put a little thing up against your eye, and that is just a different way to measure your eye pressure. But either one of them will tell the physician if your eye pressure is high or not. If your pressure is found to be high, they may want to do some other tests. They may want to dilate your eyes and look in the back of your eyes, look at that optic nerve we talked about. Remember that? Look at that to see if there's any signs of any damage to the nerve already, and to look to see if there's any damage anywhere else inside the eye. They may also want to do what's called a visual field test, where they look to see if you can see the entire vision or not, if there's parts of your vision that you're starting to lose. Because people who have really bad glaucoma, as it progresses, as parts of the optic nerve start to die, the parts of the nerve that die are the parts of the vision that you can't see anymore. So how do you treat glaucoma? Eye drops. There are several different types of eye drops that will work. Sometimes you need one type of eye drop, sometimes you need multiple, depending on how high your pressure is. But what those eye drops do is they work to improve the flow of that fluid and bring that eye pressure down. Now, those eye drops only work to decrease your pressure while you're taking them. If you don't take them, it's like you never took them. So if you stop, your eye pressure just starts going back up like they were before you were taking them. So if you have any problems with the drops, you definitely don't want to stop them without talking to your doctor first, and so they can see if they need to change it. So the last thing we're going to talk about today is macular degeneration, which is that little spot that we can't see here, which is the center part of your eye. And so that degenerates for reasons we don't understand. We think right now is that you have new blood vessels that kind of grow over that area, and so it clouds it. And so what happens when you have macular degeneration is the center part of your eye, center part of your vision really starts getting blurry. So if you're looking at me right now, kind of this center part of me would start to get blurry and get more and more blurry as the disease progresses until it eventually goes black. And so every place you look, you just see a black spot in the middle. And so now that's also a condition that is mostly age-related. This one typically affects people mostly over the age of 65. Now, there are two types of macular degeneration. There's dry and there's wet. Dry is the most common type, and that's about 85 to 90% of the cases, and that causes more of a gradual vision loss. So if you're looking at me now, it's just a gradual, over the years, that center part starts getting more and more cloudy, more and more blurry, and then it's gone. The wet form is rare. Only about 10 to 15% of cases have that. It moves very quickly. It can cause severe vision loss or even blindness. And again, right in that center part. And sometimes you can start with the dry and then you progress to the wet. So what causes macular degeneration? For the dry, we don't really understand what causes it. The wet, as I said, we think is that it's caused by an uncontrolled growth of new blood vessels. So the blood vessels here, they just grow over that area and then just cloud it up. And so that's why you can't see. Risk factors for macular degeneration: age, as I said, most people develop it over the age of 65. Smoking, family history, if you've had any type of surgery, especially for cataracts, certain medications, genetic factors. This disease is most commonly in Anglo-Americans for reasons we don't understand. People who drink a lot, especially if you drink more than 3 drinks in a day, that increases your risk for developing it. Certain medications as well can increase your risk. So the symptoms for the dry, as I said, it's more of a gradual visual loss. You have trouble reading or driving. You might see kind of little blurred spots in your vision, and you may need to start using more light or more magnification to read or do needlepoint or things like that. If you have wet, it's an acute vision loss sometimes, but sometimes it can start off where you just get a distortion of your vision, where straight lines just start looking wavy instead of straight. So if you're looking at a corner, it'll look wavy as opposed to looking straight. And so how is this diagnosed? Just like with the others, you need to go see your eye doctor to get diagnosed. This is not something that your regular family doctor can diagnose. So they would do a dilated eye exam. They'd look at the retina, that part, looking to see if you have any new blood vessels growing over that macula or anything else. And there are some other certain specialized testing that they can do to determine if you have macular degeneration. We won't go into that. It's a little too detailed for what we're talking about today. So how do you treat macular degeneration? The number one thing that you want to use for both wet and dry macular degeneration is a specialized combination of vitamins and minerals. It's called the AREDS formula, the AREDS formula. I won't go into what that stands for, but there are several different types. You've probably seen them advertised on TV, or you may have seen them in your local pharmacy. They're over-the-counter vitamins, but they have very specific things that are in them as opposed to just your regular daily multivitamin that you may already be taking. So it's a different type of combination of vitamins. Now the wet type, again, that's the more common, not the less common, but more severe type of macular degeneration, may also be treated with specialized treatments because it does have those new blood vessels. Sometimes you can treat it with laser treatments to scar down those new blood vessels. Again, there's several other treatments in addition to that. So the main thing you want to try to do as far as macular degeneration is to prevent it. If you smoke, you want to stop smoking. If you don't smoke, obviously you don't want to start. But even if you already smoke and you have been smoking for a long time, if you develop macular degeneration as a smoker, if you stop, you won't reverse the course of the disease, but that may slow the progression of the disease. So that may help preserve your vision to keep you from losing more of your vision. But the main thing with any of these things, so we talked about, I kind of threw a lot of information at you, but I want to take a moment to really kind of hammer home a couple of important parts. The things in your eye that can go wrong are things that sometimes you may not realize are going wrong until the damage has already been done. Like macular degeneration, it can be going on for a while before you notice it. Glaucoma, you can have that high eye pressure for a really long time before you start to notice the problem. Because some people, the glaucoma can develop, and by the time you realize that you can't see, the damage may have already been done, especially if it's only in one eye. If you're starting to lose vision in one eye and the other eye is fine, it's harder to tell unless you do something that you only use one eye. So it's really important for any of these, whether it be the cataracts, the glaucoma, the macular degeneration, you need to get your regular eye exams to look in the eyes. You want to get that good dilated eye exam where they look in the back of your eye, look at the optic nerve, look at the retina, look at all those blood vessels back there, and they check the eye pressure so that they can make sure that everything is where it should be. And they can take a look at that lens, see if it's starting to develop a cataract. They can check all those pressures, make sure that everything looks good, because you want to prevent these problems if you can, or catch them early if you can, because that's obviously, just like with so many things in medicine, if you catch it early, it's much easier to treat rather than catching it late and then the damage has already been done, and then it's, okay, how can we just minimize the effects that have already occurred. Whereas if you catch, say, glaucoma early, when you haven't really had any vision loss, it makes it less likely that you'll have any vision loss. If you catch macular degeneration early, if you get on those vitamins, that'll slow the progression, so it makes it less likely that you have vision loss. Cataracts doesn't matter quite as much because it's such a slow-moving process generally that if you go on even a semi-regular basis, by the time you catch it, it has not progressed to that much of an extent to where it's that damaging. And the thing about cataracts, because you can just remove the lens and replace it, it does not cause the permanent damage like glaucoma does, like macular degeneration does, because those, since they affect the inner part, the nerves of the eye, once that damage is done, it's done. It can't be undone. With cataracts, it's like just cleaning a window. So once the window is clean, then you can see again. So that's less of a permanent issue than some of the other things. So again, I know I've thrown a lot of information at you, but I hope you could see what's going on. And then if you have any questions about this, definitely talk to your physician about it, and make sure that you get your eye exams done on a regular basis so that you can check to see if anything is starting to develop, and if so, find out what you need to do to stop the progression of it to keep it from getting any worse, so that you can continue to have a happy, healthy, productive life for the rest of your life, so that you don't start having those vision problems as things go along. Well, that has been our show for today. I hope you have found it enjoyable and informative. Until next time, I'm Dr. Alancia Wynn. Have a good day.